This year has been the year of our emergency response solution.
We had a high expectation in terms of reception.
Why don't we already have medical record systems that are widely used in hospitals? Like, this should exist.
Hello, friends. Welcome to another exciting episode of Ready Next. My guest today is Dimeji Sofowora. Dimeji is co-founder and CFO at Helium Health, a company on the path to becoming Africa's #1 health tech brand. Prior to this, Dimeji, a law graduate and finance guru, was a general partner at Magic Fund, a venture capital organization. He has also worked in such impressive stables as the respected law firm Aluko and Oyebode, as well as blue chip financial services company Goldman Sachs. A couple of things fascinate me about Dimeji. Firstly, his love of sports, and I think we'll get a chance to dig a little bit into that. But also his love for all things to do with Africa and the progress of the continent. I would like to give you a warm welcome, Dimeji. Welcome to Ready Next.
Thank you. Thank you for having me, Tosin.
Pleasure. And I'm really excited to dive into this episode. But before we go full steam into the sort of African healthcare industry and all the promise, that it holds, I'd love to learn a little bit more about you. So I know you love football, and as I mentioned earlier, I know you love Africa and all things Africa. Take us on a journey. Tell us a little bit more about yourself.
Sure.
And your journey to where you are at now.
No, of course. And I hope you don't end this podcast early due to the rivalry, but we're here.
You never know.
Okay, let me see. Quick background about myself. So I actually studied law at a university. So I went to Leeds, University of Leeds, and then also did my master's in banking and finance law at Queen Mary in London. So I'd always, had an interest in law, especially on the finance side. And so we had worked on a software before. It was a messaging application, and this was right after uni. So I worked on that for a few months, and after those few months, we sold it to one of our clients, and it was the beginning of the awakening for us that we could actually do something meaningful, in tech, So he's more on the technical side, product side, and the overall thinking on that side of things. I do, of course, the boring operational things, but someone has to do it.
But important stuff. The money stuff. But it's cool, yeah.
Yeah. Someone has to do it. So so we did that, but around the same time, I was always thinking about, of course, moving back to Nigeria, doing stuff on the continent, so we had several conversations around how we could be, impactful in that area, So we set out to, research that, and we spent over a year just, speaking to different stakeholders, just trying to understand the space, and that was when in finding out what problem we could solve, that was where, the problem actually revealed itself, because there was actually a huge data problem. No one really knew what was going on in the healthcare space. Data was so fragmented. So for us, we decided, okay, let's solve that data problem, and also the different inefficiencies in the healthcare sector, inadequate resources, of course, lack of digitization as well. So it all made sense to then use technology to solve this problem.
Electronic medical records, as EMR, has been a lifesaver. Usually you want to come to hospital, you'll be thinking of how you get your records, and that takes a good amount of time. Because it's paper, that means somebody has to come in to search for your name, your middle name, your surname, so make sure we, match the exact person with the exact record. Now we're looking at a scenario where you have a lot of people. At a time, you can have 500 patients in a hospital. So getting that file is going to take you an hour to, if you're lucky, sometimes 3-4 hours. And if they don't see your records, you have to wait. You have to go open another file. That was the problem we were having in Nigeria, actually.
Well, so it all made sense to then, use technology to solve this problem. So what made sense to us at the time was building a software for the hospitals to aid digitization, automation, and helping solve that data problem. And that was how we ended up building at the start an EMR for hospitals. An end-to-end solution from the moment the patient goes into a hospital to when the patient leaves the hospital. All of that process.
So are any of your other co-founders medical professionals in any way? Are they doctors? Are they sort of service delivery personnel? Do they work around hospital? I mean, I know you mentioned that Goke attended Johns Hopkins University, which is famed for its medical department. But I guess he might have studied something else there. I don't know. Can you
All
enlighten?
right. Oh no. So he studied engineering. So that's why he has the product engineering experience. Well, I mean, over the years, we've surrounded ourselves with people that understand that, and we've also gotten a lot of experience with understanding the healthcare market, healthcare sector. So for us, and which is really vital as founders, is building a great team to help solve the problems that you have the vision to solve.
Actually, some of the best founders and some of the best startups were founded by outsiders that wanted to disrupt the industry.
For me, like personally, I don't think what you studied in school or your background really. Of course, there's certain things that you need that specialized equipment. Like, I mean, you have to go to medical school to be a doctor, right? So there's no negotiating that one. But other things that especially in the arts and tech sectors that you don't need to have studied that particular thing to be creative or to explore. I'm a big advocate for just trying new things, challenge yourself. You just never know.
So clearly there are issues with our infrastructure and delivery mechanisms on the African continent. But I know that the medical industry has many problems globally. But I wanted to kind of focus on what were the big challenges that you and the team saw, as you started to unpack, this opportunity. And what were the early kinds of resistance or struggles, if you like, that you guys had to overcome?
Sure, of course, yeah. So I would say at the start for us, there's like three main challenges that we saw, and first was the inefficiencies in healthcare delivery, so inadequate resources and lack of digitization or automation. So the infrastructure, even building a software, and then for us, we couldn't just take the software out to hospitals because first off, especially in very rural areas as well, right? First off, the infrastructure to use your software isn't there, so it's like so it's like you have a software, but okay, the hospital doesn't have computers, they don't have good internet for the cloud network, they don't have consistent power to power these devices. So yeah, there was the infrastructural challenges that we faced while trying to solve these inefficiencies. So that was a major sticking point for us. So at different points we had to find creative ways and work with these healthcare facilities to solve these problems, whether it's working with vendors that provide solar power, companies that provide computers and similar devices, just to ensure that they have the appropriate infrastructure to use the software,
Right.
And then second problem that was paramount or is paramount was the healthcare financing deficit, you know. So so and which of course limits the resources available for these hospitals, So hospitals finding it hard to get financing, they go to the banks, but the process for collecting loans or accessing funds is arduous. So they tend to start the process but not end up going through the process, and that affects the financing available to them. So
Yeah.
so there's a huge gap in financing for hospitals, and that was what led us to, after a few years of running the company, we sat down with these facilities, and we realized that this was a huge problem. So this led us to launch Helium Credit, which is our financing solution where we provide loans to healthcare facilities, to solve this major challenge that they face in healthcare delivery. So.
Yeah.
So for us, the healthcare financing deficit was another challenge, and the limited resource availability, whether it's working capital or medical equipment, the asset financing, or they needed to open a new location. There was just that financing gap that was there that we felt the need to bridge. So that was I would say, the second challenge. The third one, of course, is on the data, access to data, and
Yes.
yes, exactly, limited access to data, and which for us was major because healthcare stakeholders, for instance, the government, pharmaceutical companies, aid agencies, they need data to inform the decisions. You want to know what diseases are prevalent in an area. You want to know what areas you need to allocate resources, certain resources to public health stakeholders need to think through these problems with data, because it helps you to target the resources, and avoid wastage. So for us, but remember when I said, when we started off, the data problem was something that stuck to us, and it's, yeah, so that was a huge sticking point, that access to data. So for us, the challenge that we want to solve as well with technology. So those I would say were the three main things for us.
And I think that's really a massive undertaking because, as it said, you're trying to solve one problem on the continent of Africa, and there are like 10 child
Oh
problems.
yeah,
Kind
oh yeah.
of,
When we started when we started off, we thought, oh yeah, we just build an EMR, everything will be fine.
just put it
And
out
now,
there. Yeah.
and now we find ourselves, doing like multiple things that we didn't initially sign up for, but we sort of have to do. So yeah, and I'm sure there's more coming, but
I mean, I
yeah,
guess that's the beauty and the challenge at the same time of being an entrepreneur is that
yeah.
that there will be challenges that were unforeseen, when you started out. But, big things like, providing computing infrastructure or helping to solve for alternate power supply. You have a few verticals within the business now. What do those look like? What are the different service lines that you have, for want of a better term, within Helium Health?
Sure thing. Okay, so I would start with our Helium OS, our operating system, which is the electronic medical records hospital management information system. So that is the heart of the the hospital, the engine that makes the healthcare facilities run. So with that, hospitals are able to manage their processes seamlessly. And the way we thought about it was ensuring that it follows the stages of a patient's journey in the hospital, right? So from when the patient comes in, of course, you see the front desk, they take your social information, your profile, and ask you, those initial questions, and then
Yes.
you get transferred to, the nurses station. They take your vitals, so all of that is, done on the EMR that's imputed, and then you get transferred, say, to the doctor, and the doctors have open up a medical encounter note where, they when they're onboarded, they can build the forms. So because doctors typically know how they want to interact with the patient,
Yes.
so they have a particular flow that they want, so they can
Yeah.
they can customize this form to how they want it. So then once they see the patient, they just follow that flow.
Flow. Yes.
So yeah, of course, they see the doctors, and we place a lot of premium on the uniqueness and the user experience, and the UI, just to the user interface, to ensure that it's also appealing. You want to use something that looks good, but
Yes.
and also very simple to use. A lot of these users and healthcare professionals, of course, use social media, and they're used to the timeline view of, you're scrolling on the timeline, you click here.
Scroll. Yes.
Exactly. So we also built it like that to make it intuitive, to something that people are already used to as well, with that user experience. So
No, I'm
so yeah.
fascinated. If I jump in there,
Mhm.
I think you're making some really fantastic points that, very easily we can gloss over. But the first thing is, I like how interchangeably you use the word patient, user, and customer. Um, I don't think in Africa the thinking is that, your patient is actually a customer, that your patient is actually a user. And I also think it's fascinating that you're not going in trying to change the doctor's approach, especially because, just like every other client, doctors all have their individual processes. Each hospital has a way of doing their thing.
Yeah, sure. Yeah, so outside of that, so the learnings that we gained from the Helium OS was, I said earlier, we realized that these hospitals needed financing, so that's when Helium Credit came into play, and for us, this was to help them get, short-term loans that otherwise would have been very difficult to obtain from, financial institutions that they're typically used to, because they're going through the same process. If you had to buy a luxury car, for instance, and you go to the bank for a loan, it's the same process you follow will be the same process the hospital will follow to get
Yes.
that loan. So
Yeah.
for us, we decided, let's try to do this and make the process seamless.
Nigerians are traveling abroad for medical tourism. 2020 has been a masterclass in the importance of healthcare industry. I would say the jury is still out on whether we have learned the lesson from COVID. We first need to come through COVID to see if we've learned that lesson.
In Nigeria, for example, when health facilities need credit, traditional lending institutions like commercial banks don't find healthcare to be particularly attractive businesses to give loans to.
We all know what the pressure it places on our foreign reserves when it comes to demand for foreign exchange. It's the figures are staggering. So if other countries are making money from our citizens, it is viable. Healthcare is everybody's business. At some point in your life, you will have full body contact with the healthcare industry, whether it's the day you're born, the day you die, or somewhere in between. You will meet a doctor, you will be in their office, they will meet you, you will go to a pharmacy, you will get tests done. Somehow, some way, you will come into contact with the healthcare industry. The number one biggest problem every industry in Nigeria faces is an access to capital.
Africa has a $66 billion per annum healthcare financing deficit, meaning we need that much more.
Have a credit decisioning system that was very seamless, easy to follow, get a team around it, engage the users, and go to the hospital owners, just hear from them, have that relationship with them, and the way we thought about it was some of them are using the software, some of them are not. But once they, obtain these loans and they're not using the software, they're more amenable to then using the software. And we realized over the years that this financing gap has been something that they've been waiting for, and the demand ended up being really really high on that. So yeah, that was a very important business line for us right
if I
now at
can
the company.
segment.
I'll say the only other thing that I can just touch on briefly is the way we also think about the delivery of this, right? So of course, public health is a very important area in healthcare, right? So, and for us, we cannot ignore that. So we do work with public health organizations, to help in the dispensation of healthcare. So whatever initiative they have, whether it's on the maternal side or infant mortality side, any sort of public health initiative that our technology can help with, well, we work with public health organizations to then help them we then become their technical partner, the technology partners in solving those problems. So that's another way we help in the delivery of our healthcare solutions.
You talked about rural access. There are places, if we use Nigeria as an example, that you can walk into, you want to actually digitize, you want to help, but some things are missing, and I think this, for instance, might be an opportunity for the government to come in. So what areas do you think the big stakeholders should pay attention to?
Yeah, of course. And I would say, in thinking about the rural areas, this is where, universal health coverage, comes into play, ensuring that there is access to healthcare for anyone in the country, regardless of the economic, status or, region, right? So universal healthcare access and ensuring that the infrastructure is available, and not just available, is operational in these areas. So investing heavily in healthcare infrastructure, and I think in doing this, a lot of public private partnerships would be essential. So government and the private sector working together, pulling the resources to ensure that healthcare access is available, nationwide. So that's something I would highly advocate for. But also, data-driven decision making is vital. To do all of these things, right? Instead of diving in, going in blindly, following the data, looking at the data to ensure that, okay, well, doing the universal healthcare coverage, I mean, you're not just going to start with everything at once, right? You can follow the data, see where is best to start with, or the private sector, the public sector, the individuals. Everyone has to work together to ensure that the success of this is paramount.
And those are the things that then translate into more positive health indicators, for the public. So I find it really, fascinating, this entire world of being able to apply technology to healthcare. But maybe it would then lead me to this question, that why does Helium Health, in your opinion, think you want to be the number one brand in Africa, delivering this innovation, delivering this transformation?
Yeah, sure. So for us, like I said, technology is something that we really, really, care about, and solving problems through technology. But, and before we started this, a lot of research went into it, right? Looking at different problems, looking at different areas, but it was the healthcare sector that we looked at and we were like, okay, there's a lot of impact we can make here. And for us, it was the potential impact that led us to decide on this, right? Because because healthcare in itself isn't the most, isn't like the sexiest
Yeah.
sector,
Hey,
a sector, yeah,
yes,
sector to
I know what
to
you mean.
work at. Yeah. But for us, we know that it's not healthcare isn't going anywhere, right?
Yeah.
And it's very important. There's every individual thinks about their health. Every government thinks about the healthcare sector. So it's something that we know it's always going to be important, and the impact we can make here, especially in the continent, would would pretty much be everlasting. So for us, it was really about that the potential impact that technology with healthcare, with the solutions that we've built and will deploying, how that would resonate around across the continent.
That's great. I mean, I almost can hear you paraphrasing something that gentleman I think that you will know very well, Paul Graham of Y Combinator,
Hmm.
would say that if you're solving a problem, look for a big and real or boring problem, because boring problems tend to be real problems. Whether it's in healthcare, whether it's in transport, whether it's in rural electrification. These aren't things that we all wake up, feeling warm and fuzzy on the inside about, but they're essential. So if you think about the next 3 to 5 years, what will be your goal, your ambition as Helium Health, in terms of your picture of success?
Yeah, sure thing, sure thing. I mean, funny you mentioned Paul Graham, because we actually went through Y Combinator
Wow,
in 2017.
fantastic.
Yeah, so maybe we did hear that somewhere, and that stuck with us. So
Right.
yeah, that was funny that you mentioned that. Yeah, so for us, I would say next 3 to 5 years is just really cementing ourselves as the go-to healthcare technology company in Africa, in the region, just ensuring that all we've connected with the different stakeholders, everything that we've said we want to do, everything, the impact that we've said we want to achieve, that we have done that. um I mean, we're still a long way away, but I would say, for us, it's just, getting to that point where, we've accelerated that, data-driven thinking around healthcare in the continent. So yeah, I would say just getting to that point for us would count as success.
That's brilliant. I mean, you talk about impact, you talk about being the go-to healthcare brand, on the continent. That's a very bold assertion, but I can see, just talking through the detail with you, the work that you guys are doing on the journey to getting there. I wish you um, the absolute best, as
Thank
you go
you.
on that journey. And as we start to wrap up,
Hmm.
I want to just drill further into that future perspective that we started to talk about. You know, as Africans, I'm sure a lot of Africans are watching and listening to this, and the rest of the world is also paying a lot of attention to Africa these days. Medical professionals, and also maybe the users and customers that you mentioned, the patients, the public who will access, no doubt, some of the systems that you're helping put in place. Should they all remain hopeful? Or should we just, manage our expectations?
I like how you phrase that. So I mean, well, doing this, if I mean, I'm here, speaking to you about this, I wouldn't be here if I was in hopeful, right?
That is
So,
true. That is true.
yeah, so that's step one. But I would say it's it's not gonna be an easy, journey. There's still a very, very long way to go. There's still many more challenges to come, but of course, the desire, the hope, the working towards overcoming those challenges is something that we're ready for, and we hope to achieve. But I would say overall, yeah, of course, we have to be hopeful. There is the vision is there, and it's just about the journey to getting there. So if the vision wasn't there, then there wouldn't be any point in doing it. But speaking to people that care about this, working with people that care about this, even you, accepting to, you hear what we have to say about this as well, is, getting to that point where everyone, whether it's, just passively listening or, actively taking part, doing one thing or the other in different healthcare communities, and be different healthcare stakeholders, because it touches everyone, whether you like it or not, right? So I would say yes. It's a very, very hopeful future. There's no easy way to get there, but we will get there, hopefully.
Yeah.
Well, we're all here when we get there, but yeah, I know for a fact that we will get there.
Amazing. I love you ending on the note that we will get there, and that is a hopeful future. Whether that is this, our sunny sunrise somewhere in the world disposition as Africans, or whether it is the fact that through the experience of the work that you're doing, you're starting to see transformation gather steam. I want to join my hope, to yours, and tell the viewers, the listeners, that healthcare is fundamental on the continent, and we're very proud and excited to see the kind of work, groundbreaking work, I might add, that a fantastic brand like Helium Health is doing in this space, opening up, healthcare infrastructure, data-driven healthcare, and the delivery of phenomenal healthcare on the continent. Massive thanks to you, Dimeji. Thanks to Goke, your entire team, and to you, the audience. Thanks for watching, and I'm inviting you to join us on the very next episode of Ready Next.